Today we're diving into a topic that's pretty crucial to our well-being, mental and brain health. And we're really going deep into this new framework from the World Health Organization that explores the connections between mental health, brain health, and substance use.
Yeah.
They're calling these M&S conditions.
It's really interesting, this framework, because it moves beyond just looking at these conditions separately, like in isolation.
Right.
It helps us to see the bigger picture, how all these issues, which seem kind of separate, are actually all really intertwined.
So instead of treating them like as separate things,
Yeah.
the WHO is saying like we need to understand how they all kind of fit together.
Yeah.
But before we get into that,
Yeah.
I think it's important to kind of start with the basics.
Sure.
What exactly does the WHO mean when they're talking about mental health versus brain health?
Right.
I feel like those terms get thrown around a lot.
Yeah.
I'm not always sure everyone understands the difference.
You're right. It can be, they can be confusing, those terms.
Yeah.
The WHO is very specific in its definitions.
Okay.
Mental health is defined as a state of well-being where an individual can cope with the normal stresses of life, can work productively, and contribute to their community.
Right.
It really emphasizes your ability to thrive and not just the absence of mental illness.
So it's not just about avoiding, the negatives. It's about actively pursuing being well.
Exactly.
Okay.
And then brain health is defined as the proper functioning of the brain across all domains: cognitive, sensory, emotional, behavioral. So it's about reaching your full potential throughout life.
Right.
Whether or not you have a specific neurological condition or not.
I see.
Yeah.
So brain health is really the foundation for mental health.
Exactly.
Okay.
Yeah.
But what's really interesting to me here is this idea of a continuum of experiences that the WHO keeps emphasizing.
Yeah.
Can you elaborate on that?
Absolutely.
Yeah.
The WHO recognizes that mental and brain health aren't just black and white. You have a condition or you don't.
Right.
We all fall somewhere along a spectrum.
Right.
And that spectrum ranges from, thriving to struggling.
Okay.
And our position on that spectrum can move throughout life. It can go up and down.
Depending on
different factors and things that happen.
Right. I like that because it takes the pressure off this idea of needing to be perfectly healthy all the time.
Exactly.
It acknowledges that we're all human and we face challenges.
Exactly.
Things happen and that can impact our mental and brain health.
Absolutely.
And it's okay.
Yes. Recognizing that everyone falls somewhere on that continuum helps us to understand why addressing these issues is crucial.
Yeah.
For everyone.
Right. Not just people who have...
Not just for those with diagnosed conditions.
A diagnosed condition. Right. This brings us to this question of, why should I care?
Yeah.
And, I have to admit, when I first started looking at this framework, I was surprised to learn that mental health, neurological conditions, and substance use disorders, they share a lot of the same root causes.
Yeah.
I always thought that those were very distinct issues.
It is a surprising finding.
Yeah.
But, when you look at the research, it becomes clear that certain factors like childhood adversity, poverty, discrimination, lack of access to education and employment, these all play a significant role in increasing the risk for a wide range of these M&S conditions.
You're right. Those are some serious heavy hitters.
Yeah.
And I'm guessing these factors impact far more people than just those who end up with a formal diagnosis.
Absolutely. That's why the WHO is very focused on prevention and early intervention.
Yeah.
Addressing these root causes can have a ripple effect.
Right.
And potentially prevent a multitude of issues down the line.
It makes you wonder, if we tackle these social determinants more effectively, how many cases of mental illness, addiction, even neurological conditions could we prevent?
It's a powerful thought.
Or at least mitigate.
It really speaks to the need for a more holistic approach to health and well-being, to consider all these factors.
Yeah. And the WHO doesn't shy away from calling out the significant challenges that we face in addressing these issues.
No.
They highlight things like lack of awareness, limited access to services, human rights violations, insufficient funding.
Yes, those challenges are very real.
Yeah.
And deeply concerning.
Yeah.
For example, did you know that in many countries, mental health services get a disproportionately small share of healthcare funding?
Wow.
despite the significant burden that these conditions place on individuals and on society.
It's almost like we're still treating mental and brain health as an afterthought, despite all the evidence that it's so crucial to our well-being. This brings us to another key aspect of the WHO framework. This idea of shared neural pathways. It's illustrated in Figure 1 of the framework. And it's incredibly fascinating.
It is.
Okay, explain this to me like I'm 5.
Okay.
What are neural pathways?
Okay, so imagine your brain like a vast network of interconnected highways. Okay, these highways are the neural pathways, and they carry signals between different parts of your brain, allowing you to think, feel, and act. What's fascinating is that the same neural pathways that process rewards, like that good feeling you get when you achieve a goal or eat something delicious, those are involved in regulating your mood, making decisions, and controlling your impulses.
Wait, so you're saying that the same pathways that like light up when I'm happy are also involved when I'm like struggling with anxiety or
That's exactly right.
trying to resist a craving?
It really highlights why things like anxiety, depression, substance use disorders, and even neurological conditions like dementia or epilepsy aren't as separate as we might think. Disruptions in these shared pathways can manifest in lots of ways.
I see why the WHO is calling this like a web.
Yes.
It's all interconnected.
It's all connected.
But how does knowing about these pathways change how we approach
Well, for one thing,
health and treatment?
it shows us the importance of early intervention. If we can address the underlying issues early on, particularly during childhood and adolescence, when the brain is developing, we might prevent lots of problems later. It
also makes me wonder if we need to rethink how we approach treatment. Because if they share these common pathways, maybe we need more, like integrated treatments that target those pathways.
You're spot on. That's a key theme we'll be exploring further. This leads us to this concept of comorbidity, which the WHO also emphasizes. It basically means that these conditions often occur together and can actually influence each other's severity.
So, for example, if someone has like suboptimal brain health, maybe due to genetics or even a head injury, they might be more susceptible to developing like depression. And then struggling with the depression leads them to maybe substance use.
Precisely.
Which further harms their brain. Creating this like vicious cycle.
Exactly. And the WHO highlights that this interplay between the M&S conditions leads to poorer health outcomes overall. It's a complex web.
It is.
But understanding these connections is so crucial for developing effective interventions and support systems.
It's clear that there's still so much
there is.
we don't know about the brain.
Yeah.
And all these factors that affect our mental and neurological well-being.
Absolutely.
It's both fascinating and a little daunting.
It is.
Speaking of challenges, we can't ignore this elephant in the room, this stigma.
Yes, stigma is a huge barrier
surrounding M&S conditions.
It is, and that's a perfect place to pick up when we come back.
Okay.
We'll delve into the impact of stigma and explore strategies to break down these stereotypes. Yeah, so before we even get into like solutions, we need to really acknowledge how deeply the stigma impacts people living with M&S conditions.
Absolutely. It's a shared struggle. It affects individuals, families, entire communities.
It's heartbreaking, you know, to see how much shame and silence surrounds these issues. Like you were saying before the break. I've encountered the stigma firsthand, both in my own life and seeing it affect people close to me. And it really can feel like this invisible barrier.
It is.
That prevents people from even seeking help.
And from connecting with others who understand what they're going through.
Absolutely. And the consequences are far-reaching. You know, the WHO framework really emphasizes the societal costs of this stigma. It can lead to discrimination in housing, employment, even access to health care. It can also fuel human rights violations where people are denied basic freedoms and opportunities simply because of their mental health or neurological condition.
It's almost like society is punishing people.
It is.
For things that are often beyond their control. It makes me wonder, like, how much progress could we make if we just tackled this stigma head on?
It's a critical question, and the WHO framework does offer some hopeful strategies for reducing stigma. Education is a key component, of course.
Right.
We need to increase public understanding of these MNS conditions, what causes them, how they can be treated, when people have accurate information. It's harder to hold on to those harmful stereotypes.
Totally agree.
Yeah.
And I think storytelling has a really powerful role to play here, too.
Absolutely.
Sharing personal experiences,
yes,
both the struggles and the triumphs, can really help humanize these conditions and challenge these misconceptions that fuel this stigma.
Human connection is so powerful.
Yeah.
That leads us to another strategy.
Okay.
Social contact.
Right.
When people have positive interactions with individuals living with MNS conditions, it breaks down those walls of fear and misunderstanding.
Right.
It helps us to see each other as people first, rather than, just labels or diagnoses.
I've seen that in my own life. Like, the more I've learned about these issues, the more I realize how many people around me are dealing with, their own mental health, neurological challenges. It's a reminder that we're not alone.
We're not. And that brings us to the WHO's call for these integrated approaches.
Okay, let's dig into that.
Yeah.
So they're advocating for these integrated policies and programs and care services for all these MNS conditions. But honestly, integrated approaches can sound kind of vague.
It can.
You paint us a picture.
Yeah.
What does this actually look like in the real world?
Imagine a healthcare system where mental, neurological, and substance use needs are considered, regardless of where you enter the system. So for instance, if someone goes to their doctor for a physical checkup, that doctor should also be able to screen for mental health issues and provide support or refer them to the appropriate services if needed.
Okay, so it's about recognizing that our physical and mental health are intertwined and treating them as such.
Right, like a whole person approach.
Yeah, like a whole person approach to healthcare. Okay, that sounds ideal. But I'm curious about the practicality of that. Is that something that could be implemented?
It is.
On a large scale?
It is. It's definitely a shift from the way healthcare often operates.
Right.
But it is achievable, and the WHO framework does highlight a real-world example of successful integration.
Okay.
It's box 3 in the framework, and it focuses on what Paraguay has done to integrate its mental health and substance use services.
Okay, I'm all ears. Tell me about Paraguay's approach.
Okay, so Paraguay has accomplished something remarkable, especially considering their limited resources.
Right.
They started by enacting a new mental health law that specifically promoted these integrated services.
Okay.
They followed this up by developing a national mental health policy and action plan.
So they weren't just talking about it, they were putting
it into action.
Concrete plans into place.
Exactly.
Yeah.
And they didn't stop there. They restructured their institutions to better align with these goals of integration. So, for example, they elevated the Mental Health Directorate to the National Mental Health Directorate.
Okay.
So now it has oversight of both the National Psychiatric Hospital and the National Center for the Prevention and Treatment of Addictions.
That's huge. It sounds like they're breaking down those
silos.
Silos between mental health and substance use services and creating this more unified system. Did they see actual improvements?
They did. They saw significant improvement.
As a result of these changes?
Yes, they saw significant improvement in care continuity.
Okay.
So people were more likely to get consistent care.
Right. So they're not just falling through the cracks.
Exactly.
Yeah.
They also saw an increase in community-based services.
So it's not just a theoretical model.
It's not.
It's something that's been put into practice.
It has.
And produced tangible results.
Absolutely.
That's encouraging.
Yeah.
So we've talked about how this integrated thinking extends beyond just MNS conditions themselves.
Yeah.
What did you mean by that?
So the WHO framework emphasizes the links between these MNS conditions and chronic physical health conditions.
You're going to have to explain this one to me.
Okay.
Are you saying that there are connections between anxiety and diabetes?
Think about it this way.
Or dementia and heart disease?
Many of the factors that influence mental and brain health also impact physical health.
Okay.
Think about childhood development, the environments we live and work in, access to health care, our social support networks.
Okay. I'm starting to see it.
These all play a role
Okay.
in shaping both our physical and mental well-being.
So if someone grows up in poverty with limited access to
Right.
healthy food or health care,
Yeah.
they're at a higher risk for both physical and mental health problems
Absolutely.
later in life.
Yeah, and then there's also the impact of
Right.
M&S conditions themselves
Okay.
on physical health.
Right.
For example, the WHO framework points out
Okay.
that high blood pressure and diabetes
Mm-hmm.
are risk factors for dementia.
Right. And people with chronic illnesses like diabetes or heart disease
Yes.
are more likely to experience those mental health challenges,
Exactly.
like depression and anxiety.
It makes sense when you think about the emotional and psychological toll
Right.
of managing a chronic illness.
Right. It all comes back to this web
It does. It all comes back to that web.
of interconnected factors.
Yes.
And we can't really address one
We can't.
without considering the other.
Right.
Okay, we're seeing how vital it is to address all of these issues together, not in isolation, but I have to admit it's feeling a little overwhelming.
Yeah.
Like, where do we even begin to tackle all of this?
Don't worry.
It feels huge.
The WHO framework doesn't just highlight the problems.
Okay.
It provides actionable steps that individuals, communities, and governments can take to make a difference.
All right, I'm ready for some solutions.
Okay, so
We've been unpacking this World Health Organization framework for mental, neurological, and substance use conditions, or M&S conditions as they were calling them. And it's clear that these issues are like complex and interconnected.
Here you are.
But that also means that there are many points where we can intervene and make a difference.
Absolutely.
So before the break, we were talking about how the framework outlines these 3 areas for action: leadership and governance, care services, and promotion and prevention.
Yeah.
Let's start with that first one, leadership and governance.
Oh.
Honestly, those terms sound a little dry.
They do.
Bureaucratic to me.
I understand that.
Why are they important in this context of mental and brain health?
Well, they're really the foundation for change.
Okay.
Strong leadership and effective governance are what set the stage for progress.
Right.
We need leaders at all levels, from government officials to healthcare administrators, to community organizers, to prioritize mental and brain health.
So making sure that these issues are at the forefront?
Yes, at the forefront
Of public health agendas.
Absolutely.
And that resources are allocated appropriately.
Exactly. And it's not just about top-down approaches.
Okay.
The WHO emphasizes community engagement,
Right.
grassroots advocacy.
So it's about like people demanding change?
It is. It's about making our voices heard,
Right.
sharing our stories,
Yes.
and pushing for systems that meet the needs of our communities.
I like that it reminds us that we all have a role to play.
We do.
Our collective voices can really create change.
Absolutely.
Okay, let's move on to care services.
Okay.
The WHO is calling for this major shift toward integrated care for M&S conditions.
Yes.
Can you give us some concrete examples of what that looks like?
Imagine a healthcare system where someone can walk into a clinic
Okay.
and have their mental, neurological, and substance use needs considered,
Right.
regardless of their initial complaint.
Right. Okay.
So let's say someone goes to their doctor for a checkup. That doctor should also be equipped to screen for mental health concerns
Okay.
and provide basic support.
Yeah.
Or refer them if needed.
That would be huge, especially for people who don't even realize they need support or are hesitant to seek it out.
Exactly.
Makes it more accessible.
It does.
Reduces stigma
Absolutely.
associated with getting help.
The WHO framework highlights the need to train non-specialized healthcare workers
Okay.
to provide basic mental and brain health care,
Makes sense.
especially where specialists are limited.
This brings up a question I had. Realistically, how can we expect, primary care physicians to take on this added responsibility of addressing mental health
Yeah, it's a good question.
when they're already so busy?
It requires a shift in how we approach healthcare education, funding, and service delivery.
Right.
The WHO calls for increased investment in workforce development,
Okay.
better integration of mental health into primary care, and clear referral pathways
Yeah.
so people can access specialized care when they need it.
It sounds like a big undertaking.
It is.
But the benefits could be huge.
The benefits are huge. It could transform how we approach mental and brain health.
Right. Care would be more accessible,
Yes,
holistic, and integrated.
absolutely.
And beyond improving access, the WHO also stresses the importance of providing high-quality care.
Yes, evidence-based care.
Right. That truly helps people on their journey to recovery.
Yeah, they advocate for these integrated recovery models
Okay.
that go beyond just treating symptoms and focus on helping people achieve their full potential.
What would that look like? Can you give me an example?
Sure, imagine a program for someone recovering from substance use disorder.
Okay.
It not only addresses their addiction, but helps them to develop coping skills,
Right.
build social connections,
Yeah.
find meaningful work,
Okay.
and reintegrate back into their community.
So it's about supporting the whole person,
Exactly. Not just the condition.
not just their diagnosis.
It's about empowering people
Right.
to take control of their health and their lives.
Okay, so we've covered leadership and governance, care services. What about that third area, promotion and prevention?
Yes, promotion and prevention are essential.
I feel like those are often overlooked
They are.
when it comes to healthcare, but they're so important for mental and brain health.
Absolutely. There are so many things we can do at
Right.
the individual, community, and societal level to promote mental and brain health
Okay.
and prevent these conditions from developing.
Can you give us some examples? Like, what can we do
At the individual level,
as individuals?
it comes down to healthy lifestyle habits,
Okay, like what?
regular exercise,
Right.
balanced diet,
Yeah.
getting enough sleep, managing stress, nurturing those social connections.
Right. It's like what we do for our physical health benefits our mental health.
It does. It's all connected.
But individual choices can only take us so far, right?
That's right. We also need to address those broader societal factors.
Right, like poverty, discrimination,
Exactly.
lack of access to education and employment.
Yes, these are complex issues.
Yeah.
But they're not insurmountable.
Okay.
It requires effort from policymakers, community leaders, all of us,
Right.
to create a more equitable society where everyone can thrive.
What about specific actions to promote mental and brain health in our communities?
There's so much we can do.
Okay.
We can support organizations working to improve services,
Yeah.
volunteer at shelters or support groups,
Okay.
participate in awareness campaigns.
Simply be there for people in our lives who are struggling.
Yeah,
We can create a culture of compassion and understanding.
right, where people feel safe to talk about their mental health.
Exactly, and to seek help without shame or judgment.
I love that.
Yeah.
So as we're wrapping up this deep dive, I'm feeling kind of a mix of emotions.
I understand.
I'm definitely a little overwhelmed by how complex all this is,
It is complex.
but also inspired by the potential for change.
Yes,
The WHO framework gives us this roadmap,
it does.
and there's so many places where we can make a difference.
There are.
What's your biggest takeaway from all of this?
The most powerful message is that we're not alone in this.
Yeah.
These are shared challenges that affect all of us.
Right.
And solutions require a shared responsibility.
So we all have a role to play
We do.
in creating a world where mental and brain health are valued and supported.
So as a final thought for our listeners, we want to leave you with this. Knowing what you now know about how interconnected all of this is, what one action will you take to make a difference in your own life or in your community?